Alright, today I'm going to be doing a speech on the Mayo Clinic. The purpose today is to inform my audience about the start of the Mayo Clinic, the new technology, and the personnel. The Mayo Clinic is a leader in healthcare and research. The new expansion for the Mayo is hopes to get improved and to increase the personnel, and not only that, but to increase the room for new technology and more beds. Every year, more than 1 million people from all 50 states and 150 countries come to the Mayo Clinic for care. The Mayo Clinic has about 58,300 personnel. The first memory I have of the Mayo Clinic is taking my grandma to her doctor's appointments for her heart. Today I'll be educating you on the start of the Mayo Clinic, new technology, and the personnel. Back when Mayo first came about, it is way different than it is today. The two Mayo brothers are the ones that started it in 1889 in Rochester, Minnesota. Their names are William Mayo and Charles Mayo. And the Mayo Clinic isn't just popular for their advancements in technology, but also for their caring attitude towards the patients. You would think that the Mayo brothers would have to do a lot of outside educating, but they only went to school for medical, and then they gained all their experience watching their father on his patients. In 1883, a tornado caused them to build the first hospital in Rochester, Minnesota. Before they had 27 beds. Now they have 1,132. Now from the history to technology. Technology has increased to help cure and get rid of diseases and illnesses. Published in May 29th, 2012, the local flow thermal pulsation system was created. It helped manage dry eye, to evaluate the oil glands in the face. They did a massage therapy that lasted 12 minutes to unblock the glands in the eye. It is FDA approved, and you have to wear an eye cup on your eye to make sure the light from the room isn't affecting the eye. It has no downtime or recovery. Once the patient's done, they are released shortly after. In the future, they may need to go in for future treatments, but possibly not. Another technology is an innovative piece called the ventricle assist device, known as the VAD. Mechanical device to pump blood from the lower chambers of the heart into the rest of the body. You may have to have one implanted if you have a weakened heart or heart failure. They can do implants for long-term or short-term, depending on your condition. Another technology is a PET scan. It is a sensitive imaging test with small radioactive material. It reveals and details, specific and detailed info about the organs and tissues and how it is functioning. Mayo does more than 13,000 PET scans a year. All clinics in the Mayo system in Florida, Minnesota, and Arizona all have one. And now from technology to personnel at Mayo. They range from jobs from kitchen staffs all the way to doctors. The first two doctors were the Mayo brothers. They have 3 locations in Minnesota, Arizona, and also in Florida. They have 58,300 personnel. As we found out many interesting things, the clinic we didn't know, for example, the tornado that happened in 1883. But who knows, maybe one of us are going to be working at the clinic, whether it's going to be a janitor or a doctor. Each year they have a births that are 2,000 296. Any questions?
Yeah, where was the first hospital in Rochester, Minnesota?
Downtown Rochester, currently where the St. Mary's building is now.
Heidi, where did the doctors Mayo live?
They lived in the Foundation House and also at the Maywood Mansion, located in Rochester.
Were they involved in anything else in the community, other than the hospitals?
Oh, they helped with they started the Rochester Library, which is still current there today.
Okay.
Good job.
Very good.
That was only 6 minutes
Thanks.
long.